The air quality alert in Philadelphia. As many of you know by now, the devastating wildfires in Canada have created smoke that is traveling along much of the East Coast. While they continue to battle these historic fires, Philadelphia sends our thoughts and prayers to our neighbors in Canada who have been displaced, who have lost their homes, businesses, and property. We hope that the smoke may lessen today, but it's still potentially dangerous, and we urge residents to continue taking precautions. Health Commissioner Dr. Bettigal is here with us today and will review the recommendations and resources for our residents. Smoke outdoors also presents a danger to those working outdoors, including city employees. Out of an abundance of caution, the city has directed non-emergency personnel to avoid working outdoors today. They will create impacts to the following city services. All streets department outdoor operations will be suspended. Already they started at noon today. This includes trash and recycling collections, mechanical cleaning, paving, traffic, street lighting, and street repairs. This is being done out of abundance of caution for employees sensitive to the air pollution. Residents should leave their trash and recycling at the regular pickup locations if their materials have not yet been collected. The Streets Department will provide additional updates later as the situation continues. In addition, outdoor programming at recreation centers will be canceled or moved indoors. Philadelphia Parks and Recreation after-school programs will be held indoors. Recreation centers are open until 9 p.m. this evening. City recreation buildings are open to the public and offer a safe indoor alternative during periods of poor air quality. Residents can contact their local rec center to confirm the status of individual programs. All city-sponsored after-school activities will be moved indoors. More details and any new updates will be posted on the city's website, phila.gov. Emergency services such as fire and police will continue as usual. Please know that we are monitoring the situation constantly and will share updates and guidance when appropriate. The health of our residents and workers is paramount. Philadelphia, please take good care of yourselves and look out for each other. Now I'll turn it over to Dr. Bettigal.
Thank you, Mayor, and good afternoon, everyone. The City of Philadelphia continues to experience serious air quality problems related to the smoke from the Canadian wildfires. Our air quality over the past 24 hours has fluctuated based on wind and weather patterns, and there have been periods during which the air quality index rose to over 300 and even to over 400, well into the hazardous range. We expect that such fluctuations could continue for the next several days. These levels of fine particulate, or PM 2.5 pollution, can have health effects on any of us and are particularly dangerous to people with lung or heart conditions, to young children, older adults, and pregnant people. The fine particles can penetrate deeply into fragile lung tissue, causing symptoms including cough, shortness of breath, and wheezing. This is the reason that we recommend minimizing outdoor time and wearing a high-quality mask if you do need to go outside. If you need help affording high-quality masks, you can get them at our resource hubs. To find their locations and information about the services they offer, please go to phila.gov/health. If you do have to go outside, go slow and try to avoid activities that will cause you to breathe more deeply, like running or other vigorous exercise. Reschedule plans for outdoor events and gatherings for a later date, if that is possible, or look for opportunities to move those gatherings indoors. Keep windows and doors closed to minimize air pollution in your home. Recirculate the air in your home with fans to avoid bringing more air pollution into your home. Pay attention to how you're feeling. If you're having trouble breathing, feeling nauseous or dizzy, you should seek medical attention as soon as possible. And please stay up to date on the situation, which is changing rapidly hour by hour. You can follow the Health Department and the Office of Emergency Management on Twitter. Sign up for emergency alerts by texting ReadyPhila to 888-777. And you can go to airnow.gov for updates on the air quality index in the city, and those are updated very frequently. So thank you all. I'm going to turn things over to Stephanie Tipton now.
Good afternoon. As Mayor Kenney mentioned, due to today's air quality alert, we have directed non-emergency city personnel to avoid working outdoors today. The guidance was shared citywide this morning, and we're supporting managers with implementation of the guidance. Personnel who have duties and activities that can be performed indoors should work indoors today. If that is not possible, employees may be excused for the day and will receive excused time for that absence. If employees must go outdoors to travel to and from work or between buildings or work locations, we are asking that they please wear a high-quality mask. As always, we appreciate the hard work of our employees who keep our city open and operating, and we're committed to protecting their health and well-being along with city residents. I'll now invite Dr. Watlington to join us.
Good afternoon. This morning, the School District of Philadelphia issued a communication to families and staff informing them that the current air quality this morning was rated at code maroon and that it was forecasted to improve and the air quality conditions to improve during the course of the day. We encourage students and staff to wear masks during their commute to and from school, and at schools, all outside activities such as recess, outside field trips, and field days were moved indoors, postponed, or canceled. The district's athletic office will also support schools in rescheduling outdoor athletic games that were previously scheduled. In addition, all windows and doors at school buildings remain closed to minimize air pollution. Student and staff safety and well-being continue to be a top priority for the school district. We understand the health concerns regarding poor air quality. We will continue to follow guidance from the city and are beginning to explore alternatives to in-person learning as the air quality conditions continue to be hazardous. We will continue to follow events and will confirm and share a decision regarding school tomorrow with school and communities, with schools as well as our community later this evening. Thank you.
Thank you, Dr. Washington. Does someone from the Department of Public Health will come up and give some updates to the public in Spanish? Is that area available?
Questions?
Mayor, even on the way, we're still seeing a lot of people out and about
Yeah.
not wearing masks. Do you think people are taking this seriously enough?
We're giving them the information that they need to make a decision on what's good for them. We're not in a position to force masks on people, but we're giving them guidance, and hopefully they'll follow that guidance. That's all that we can do at the moment.
Mayor, the city of Philadelphia, the children of the city of Philadelphia have an asthma rate of about 21%, much higher than in many cities in the country, maybe the highest. What's your read on the impact here on these kids, and how do you see that as a policy issue? You've talked a lot about the welfare of kids.
Well, why don't I ask the doctor?
Yeah, so we are very concerned about the kids with asthma in Philadelphia. Prior to this event, we've been working on a plan across the city, across stakeholders, for how to address asthma. Our rates are higher than in other places in the country. Some of that relates to smoking, some of it relates to indoor air pollutants related to housing quality, mold, dampness, pests. But certainly an event like this is more dangerous for kids with asthma. So, we're doing a number of things. One, of course, partnering with the school district to make sure that they have the information we have, making sure that outdoor events for kids right now are not happening, advising people to cancel those sorts of things so that the kids are inside in safe spaces. There's other work that is part of this that's really critical, and a piece of that is around primary care access. We recently announced that we're going to be opening 2 new city health centers in the area of the city with the worst access. But making sure kids have the access they need to have their asthma well controlled at baseline helps protect them in this kind of a situation. Access to masks for families who need it. We also have a program that's been underway for months now to get HEPA filter devices to schools and daycares that need them. And so we've been reinforcing that information today. to make sure that any school or daycare that doesn't have one of those devices and needs it can get access. So it's a lot of different things right now, but it's a population we are very worried about because they certainly are vulnerable right now.
Dr. Benegal, what's the response been in emergency rooms? Have you seen an increase in 911 calls related to respiratory distress, et cetera?
So I don't have 911 data, and the ER data I have is only through Tuesday night, but I've been reaching out to our hospital partners, and interestingly, they are not seeing an uptick. One hospital saw a slight uptick. The others are telling me their numbers are at baseline or even a little bit lower. So I know that I also saw people walking over here who were not wearing masks, although at this moment the air quality is better than it's been for a while. I was driving through North Philadelphia last night, and those streets, which are normally pretty crowded, were empty. I think people really have been paying attention to this warning and staying inside. So I think that's probably why we're not seeing more of an uptick. But our pediatric hospitals do not tell me that they haven't crunched their numbers yet, but they're not telling me that they're seeing an uptick, and neither are most of our adult hospitals. So that's good news.
Dr. Bagel, I have a question that I think can be answered by both you and Dr. Wellington. When we're talking about kids who are asthmatic in Philadelphia, more than 50% of schools in Philadelphia do not have air conditioning or proper ventilation in that regard. With windows and doors closed, how is that ventilation kind of contributing to those who are asthmatic or have breathing conditions? And has the school district supplied some of these schools without that proper ventilation system with air filters and things to keep kids in school during this?
Good afternoon. I'll just say quickly, you are correct. 57% of our schools do not have adequate air conditioning to be able to close schools during hot weather days. With the temperature not climbing in excess of the upper 70s today, the precaution we've taken is that we've deployed nurses throughout the schools to make sure to check on any staff or students who might have some issue, discomfort, or some kind of condition we need to pay attention to. We've been in regular communication with our school leaders to see if there's anything else that they need. I think the one saving grace for today is the outdoor temperatures not climbing above the upper 70s.
But no filtration in the rooms?
It's no secret that the average age of our school buildings is 73 years old. We're really concerned with that, and so we're taking a look at what makes sense for tomorrow, and we'll have more to say about that once we get the latest updates this afternoon. We're going to wait until we get the latest updates so that we know exactly what the data look like, but we are considering all options for tomorrow.
What's your absentee rate look like today? Do you know how many kids have stayed away?
I'll pull the absentee rate once I get back to the office. I don't have it at the moment. I will tell you that we communicated both with our leaders and the PFT and our staffs that any absences today will certainly be excused, both for staff and for students.
What metrics will you use to determine whether or not the schools will close tomorrow?
I think it'll be pretty clear once we get updated information in terms of the level of hazard tomorrow, because we want to make sure we protect the health and well-being of both students and staff.
Dr. Watt, are you frustrated by the number of days that students in Philadelphia miss because of these kind of related issues? There's heat, now is this. You said you're trying to get kids to catch up. Is this frustrating to you?
Absolutely. Our goal is for students and staff to be in school buildings no less than 90% of the month. I also understand that we can't control Mother Nature or the wind currents from another country. So I think we'll be more understanding of this one.
Hi, Dr. Benegal, or if anybody can answer this. What is the city doing for, particularly vulnerable groups, people with asthma, people with COPD? Is there any effort to reach out to them directly with, N95 masks and the other kind of help to get through the next couple of days? And are you offering shelter for people who don't have homes, who can't get inside this area?
So, in terms of what we're doing for people who are low income and at risk, we have 5 resource hubs around the city that are offering free KN95s for anybody who doesn't have access to those. So that information is on phila.gov/health in terms of where those are located and their hours. We also have been distributing information through our community partner list to make sure we're getting information about how to stay safe to everybody because, like so many events, we are concerned that this event could have a greater impact on people who are lower income, people who are Black, people who are brown. So all of those things. We are not at this point looking at a door-to-door kind of distribution of masks, just given the scale and also the timeline that we're looking at for this event. Again, we're going to be hearing more about what to anticipate over the coming days very soon. So once we have that information, we can make additional plans.
Thank you, Dr. Bethel. Before we get into Q&A, we want to give an opportunity to provide some of the student updates for the public in Spanish as well. So then, go ahead. Thank you.
Buenas tardes. Palabras de la comisionada del Departamento de Salud, la doctora Cheryl Borgo, para el día jueves 8 de junio 2023. La ciudad de Filadelfia sigue experimentando graves problemas de calidad de aire relacionados con el humo de los incendios forestales en Canadá. La calidad del aire en las últimas 24 horas ha fluctuado en función del viento y las condiciones meteorológicas. También ha habido periodos en los que el índice de calidad del aire se elevó a más de 300 e incluso brevemente por encima de 400, muy dentro del rango peligroso. Se espera que estas fluctuaciones continúen durante los próximos días. Estos niveles de contaminación por partículas finas o PM2.5 pueden tener efectos sobre la salud de cualquiera de nosotros y son especialmente peligrosos para las personas con afecciones pulmonares o cardíacas, los niños pequeños, los adultos mayores y las personas embarazadas. Las partículas finas pueden penetrar profundamente en el frágil tejido pulmonar y provocar síntomas como tos, dificultad para respirar y otros problemas respiratorios. Esta es la razón por la que recomendamos minimizar el tiempo al aire libre y usar una mascarilla de alta calidad si necesita salir. Si necesita ayuda para conseguir mascarillas de alta calidad, puede conseguirlas en nuestros centros de recursos. La ubicación de nuestros centros de recursos y más información sobre los servicios que ofrecen está disponible a fila.gov/health. Si tiene que salir, hágalo despacio y evite actividades que le hagan respirar más profundamente, como correr o otros ejercicios vigorosos. Si es posible, cambie los planes de eventos y reuniones al aire libre para otro día o busque la oportunidad de trasladar esas reuniones al interior. Mantenga las ventanas y puertas cerradas para minimizar la contaminación del aire en su hogar. Recircule el aire de su casa con ventiladores para evitar que entre más contaminación atmosférica. Preste atención a cómo se siente. Si tiene problemas para respirar, náuseas o mareos, acuda al médico lo antes posible. Y por favor, manténgase al día sobre esta situación que está cambiando rápidamente hora a hora. Siga el Departamento de Salud y la Oficina de Gestión de Emergencias en Twitter. Inscríbase para recibir alertas de emergencia en español enviando Ready Philly a 888-777. Eso es Ready Philly. Y vaya a ournow.gov para actualizaciones sobre el índice de calidad del aire de la ciudad. Con esto concluyo las palabras de la comisionadora de salud. Ahora les voy a proveer información importante sobre los impactos a los servicios de la ciudad, según el alcalde Jim Kenney. Como medida de precaución, la ciudad ha ordenado al personal no especializado de emergencias que evite trabajar hoy al aire libre. Esto afecta a los siguientes servicios municipales. Habrá posibles retrasos en la recogida de basura y reciclaje. La programación al aire libre en los centros de recreación se cancelará o se trasladará al interior. Las actividades extraescolares se trasladarán al interior. Más detalles y nuevas actualizaciones se publicarán en el sitio web de la ciudad, fila.gov. Gracias.
Dr. Pedigal, when did the number go to 400, you said?
So our Air Management Services Division tells me that the numbers peaked between 7 and 9 p.m. last night. We did have some monitors, I am told, that went as high as 500 at that time. I have the raw data. I haven't had a chance. I got it on my way walking over here, so I haven't had a chance to go through it in detail. But there was a period last night when we had very, very polluted air in the city of Philadelphia.
Well, can you explain what 500 means? I mean, it's very, very polluted. How should people think about that?
Well, the scale goes to 500. So this is terrible. That's what that, I don't know how else to say that, but it just, just dense particulates, you don't want to breathe it in. And anybody who had to go outside last night probably knows what I'm talking about. If you looked at streetlights, you could see the air, which just shouldn't happen.
Are you expecting an increase back up to those levels? What's the forecast for the next 24 hours?
So that's probably not me. Do you want me to start, or Dom?
Good afternoon. I'm Dominic Morellis, the Director for the City's Office of Emergency Management. To the question as far as the forecast for the next 24 hours, that's what's been so challenging and why you've seen us start the day thinking one thing, reacting to the conditions and responding as timely as we can. A lot of this relies on weather patterns, and the analogy that I've used, because I'm not so much into the science, but more so the understanding of the process and the systems. This is almost like a snowstorm for us. We have a bit of a prediction. We understand how bad it could be, but the timing varies. And I think anybody who's been in the city for any period of time has heard us be really concerned about snowstorms that never materialize, and similarly has heard us, quite frankly, all turn around and go, oh wow, it snowed a lot more than the forecasters had called for. And so the prediction for the next 24 hours, I'm not going to be able to say concretely, but I can tell you about the system that we have in place to make those decisions. So really since Tuesday evening, we as a city had been coordinating both on what we saw happening to the north of us, knowing that the weather patterns were coming that way, what the impacts were happening to the north of us, but also what we're seeing in our surrounding counties. And Tuesday evening, for those who may have been monitoring, would know that our counties, particularly Montgomery County, and to some extent Delaware County, were receiving a lot of 911 calls because they were smelling smoke. So we've been monitoring since that point, and really since Tuesday evening connected with the National Weather Service out of Mount Holly. They joined 3 coordination calls with us yesterday. We have another one scheduled for 2 p.m. this afternoon. And so as soon as we can wrap here, we hope to get that update for this evening and into tomorrow. But that cadence will continue, and we'll continue to adjust kind of our, of course, recommendations based on that.
Can you talk about the volume of 911 calls you've been receiving? How much for respiratory distress?
Unfortunately, no. Thank you.
Is there an update on the status of the Phillies game tonight? And is that a decision that's taken into account with the city, or is that strictly for Major League Baseball?
It's mostly Major League Baseball, and that they have not made a decision as far as I know right now. So we'll see.